According to a report by the BBC today, Scotland has been dubbed the worst nation in Europe for the prevalence of unqualified beauticians administering cosmetic treatments. Healthcare professionals have highlighted a worrying trend in the UK of members of the public suffering severe complications due to the absence of legislative measures against the practice of medical aesthetics treatments such as Botox and dermal fillers by beauticians and other non-healthcare persons. Distinct from England and Wales, Scotland does not impose a restriction on minors below the age of 18 undergoing these procedures, while most countries mandate that only qualified healthcare professionals perform medical aesthetics procedures like Botox and dermal filler injections. My international colleagues are astounded and disbelieving that the UK permits individuals without medical qualifications to provide such services legally. The situation has reached a point where the UK, particularly Scotland, is mocked by our international peers as the Wild West of Botox and dermal fillers. Since 2021, it has been unlawful in England for under 18s to receive fillers or Botox treatments. Yet, the dire situation in Scotland persists due to the absence of a similar ban, prompting young individuals from England to venture across the border for filler treatments. Alarmingly, there seems to be no intention within Scotland to regulate against non-healthcare professionals offering medical procedures like Botox and dermal fillers. This regulatory vacuum has led to individuals from areas such as Newcastle travelling to Scotland to access treatments for minors without any scrutiny. Alarmingly, an increasing number of young people discovered via social media are undergoing these procedures year after year. Annually, tens of thousands in Scotland opt for dermal filler treatments, a number that continues to grow alongside the rise in complications, which include infections, arterial blockages, permanent tissue damage, blindness, and even stroke. In 2022, the Scottish Government pledged to ensure cosmetic treatments would only be administered by suitably trained professionals, yet no further information has since been released. While the UK Government plans to issue a response to a consultation on a licensing scheme this spring, Scottish authorities have not provided a timeline for additional regulation. Social media has unfortunately played a significant role in individuals falling into the hands of inept practitioners. The surge in unqualified individuals offering these treatments has been notable, with social media enabling beauticians to offer such services with no consideration for patient safety or accountability. There has also been a rise in the distribution of unlicensed, counterfeit, and hazardous products being misrepresented as genuine Botox and dermal fillers within the non-medical sector. In the UK, Botox is classified as a prescription-only medication, meaning only a medically qualified professional can prescribe and administer it to a patient. Reports have emerged of beauticians sourcing unlicensed Botox online and administering it to clients in both salons and homes, with no certainty of the product's contents. It's a known issue that individuals are receiving Botox treatments in salons without any interaction with a healthcare professional. Take the case of Renata from East Kilbride, near Glasgow, who spent approximately $600 on what she believed were Botox injections under her eyes, advertised by a beautician on Facebook. The treatment was conducted in an extension of the beautician's home, a practice shockingly legal in Scotland. Following adverse reactions that altered her skin's color and texture, Renata sought advice from a registered clinic, only to learn she was facing a stark choice between enduring permanent damage or undergoing costly private surgery. Renata's ordeal, marked by lost confidence and visible physical alterations, is a testament to the grave risks associated with the current lax regulatory environment. Her experience is far from isolated, underscoring Scotland's and the UK's broader failure to protect the public from unqualified practitioners in the aesthetic treatment sector, For a decade, discussions with the Scottish Government have yielded minimal progress, an oversight that cannot be excused as it endangers public health by allowing unregulated non-healthcare individuals to administer injections without any form of redress. The prevailing lack of regulation has effectively created a dichotomous system wherein individuals with no medical background can legally perform injections on young individuals with impunity. In stark contrast, a doctor operating outside of a health board registered premise could face prosecution, highlighting a troubling disparity in accountability. I cannot stress enough the importance of ensuring that Botox and dermal fillers, as medical procedures, are conducted solely by healthcare professionals with the necessary medical expertise and competence to administer injections safely, manage complications, and provide appropriate advice on the necessity of treatment.